Don't pick your nose. That's right. And in addition, don't put objects up in your nose as well. Why? Well, there's a number of reasons, but one of them is because it could increase your risk of getting nosebleeds. Now, we often have to think about this with kids, but it can't hurt to say it to the adults as well. No picking the nose or sticking objects in it. Other things that will increase our risk for getting nosebleeds are colds, seasonal allergies, blowing our nose super hard, getting hit in the face or injury to our head or nose, dry air. That's right. When it gets cold outside and inside we have that forced air, it can be super dry. That can put us at risk. Also, things like blood thinners if we're on them, or certain underlying medical conditions like blood clotting disorders and things like that. Guys, I'm Dr. Jen Caudle, practicing family physician. I'm going to show you how to properly stop a nosebleed today, guys. Super important. And let me tell you, the first thing you don't want to do is you don't want to put your head back like this, okay? I think a lot of people, when they think of nosebleeds, they're doing this. No. Let's talk about the right way to do it. All right, first of all, you should know, by the way, that 60% of people will have at least one nosebleed. I know, that's a lot of people. And if you've ever had one, you know it can be really disturbing where you could just be doing something and all of a sudden you see blood and it's like, where did that come from? Sometimes we know where it comes from, sometimes we don't. There are two types of nosebleeds, anterior nosebleeds and posterior. Posterior is the one that's a little bit more tricky and potentially more dangerous. We're talking about the anterior ones. This is because we got lots of blood vessels on the inside of the nose here, capillaries and things like that, and they can easily burst, all right? So when we talk about anterior nosebleeds, first thing you want to do is you don't want to throw your head back like I just said that. The problem with that is, putting our head back can cause blood to drain back into our mouth. That can increase our risk of nausea, vomiting, even diarrhea. It can be very irritating to have that blood dropping behind in our throat. So first thing you want to do is you want to relax. Woosah, okay? Don't panic, although it may feel like a panicky situation. Next thing you want to do is you want to lean your head just slightly forward, okay? And I shouldn't touch my nose yet because I'm going to get to that, but lean your head slightly forward, just like this. You don't want to put your head in between your knees. You don't need to do all that. Don't start doing that. You just want to lean your head forward just a little bit, okay? You also don't want to lie flat either. That is super important. Make sure you got some tissue. This is toilet paper, Kleenex, whatever you got to catch any blood that might be dripping. Of course, we know this can be a little bit messy, but this is what you want to do. Make sure that you are breathing through your mouth, okay? And then what you want to do is use your thumb and your index finger. Here, let's do it this way. Use your thumb and index finger to pinch the soft part of your nose to constrict it, okay? Like this, all right? You're just leaning forward just a little bit. You're going to pinch with your thumb and index finger. You see how I do this? You hold your tissue to make sure you catch any blood. You want to hold like this for at least 5 minutes, okay, before you even check to see if you're still bleeding or not. Give it a good 5 minutes. Make sure you're looking at that timer. Give it a good chance to start clotting, okay? If you're still bleeding after 5 minutes, you can actually then hold it for 10 minutes as well, okay? Ooh, I gotta wipe my nose after doing that, okay? Compression is really what we want here, guys. The other things you can do is you could use an ice pack as well. Sometimes the ice can help constrict or kind of seal off those blood vessels so they don't bleed as much. And also something you could consider trying is an over-the-counter nasal decongestant to help constrict those blood vessels. You got to be super, super careful with those over-the-counter nasal decongestants, guys. Those are super tricky, so don't go using those willy-nilly, okay? Be very, very careful with that. As always, let's see here. Oh, and of course, you want to be careful with your nose after that. Don't go stop in a nosebleed and then go play tackle football after that, or go, boxing, okay? Let's be very careful and gentle with our nose after that. Warning signs. We always got to talk about those. Of course, what I'm telling you is not a one size fits all. You need to use the situation that you have. Always contact your medical provider to make sure you're being safe. If your bleeding doesn't stop, if there are complications, if something seems funny, you always contact somebody to make sure you know what's going on. And even though I didn't distinguish a lot between the anterior and posterior nosebleeds, remember that one is more serious than the other. That is the posterior nosebleed that tends to be bleeding in the back versus bleeding in the front. But either way, I always just say, just make sure you're checking everything through your doctor, okay? As I said before, no nose picking or sticking things up in your nose. Make sure you tell anyone who needs to know that not to do that. And of course, when it comes around to wintertime, this forced air in our house often predisposes us. Humidifiers can help, nasal saline, things like that. Anything to keep moisture in the air and in your nasal passages might actually help as well. That's something I do on my own. But as I always say, check with your doctor. Guys, I hope this is helpful. I'm Dr. Jen Caudle. I'm a practicing family physician and on-air health expert and video creator. I do daily videos. If you have not liked and follow my page, I invite you to do so. For those of you who send stars, I respond to you personally, and thank you all in advance. Guys, I am Dr. Jen. I'll see you soon.